So a lot of schools have started back up. My kids are back in school and they're doing sports and everything together. So kids are all going to be next to each other and probably transmitting the virus between each other. And since most children are not vaccinated because they're not eligible for vaccination, this is somewhat of a concern for a lot of people. And for the kids themselves, they're usually asymptomatic or have very mild disease. And so the question is um, does does mild or asymptomatic disease give children protection from future infections? And as a corollary, maybe it protects them from transmitting it to others. So I found this paper and I thought it was pretty interesting. So let's read it together. So in this study, we evaluated humoral immune response. So humoral immune response, that means they're looking at antibodies, not T cells. Um, and so they looked in 69 children and adolescents that had either asymptomatic or mild disease, and they detected that they had lots of antibodies. Okay, so notably, these antibody responses so this lasted for at least 2 to 4 months. They had neutralizing antibodies that were detectable 4 months in 94%. Overall, antibody responses to neutralizing antibody in sera from children and adolescents were comparable or superior to those observed in sera from 24 adults with mild. So the children had better antibody levels, especially of the neutralizing antibodies, than adults that had similar mild symptoms. So it seems like children generate a much more robust response, even if they have mild disease. Okay, so we'll skip the introduction because it's usually just some background information that we're all familiar with. Yeah, so we know that they have milder disease. All right. Okay, so here we go. Results. So they looked at 69 children and adolescents under 21 years of age. Okay, so median age was 11, half were female. Most common chronic medical conditions were obesity and asthma, so which is expected. Those are the two most common chronic medical conditions in children. Children are generally healthy and don't have chronic medical conditions. Unfortunately, obesity in children is rising. Most common symptoms were fever, cough, and headache. And then about 20% of their group had no symptoms whatsoever, so they were asymptomatic. Okay, so they used basically a light-based binding assay to look for antibodies that targeted the spike protein, receptor binding domain, N-terminal domain, and the nucleocapsid and membrane proteins. Okay, so they looked at IgM, IgG, and IgA. So IgM is usually the first phase, early phase antibody. IgG is the longer lasting antibody, and IgA is the mucosal antibody. So let's see. And so they're looking at month 0, 2, and 4. So you see you see a pretty steady decline in the IgM. That's to be expected. IgG stays up fairly high, with a little decline in month 4, and IgA seems to have a slight decline as well. Here's the neutralizing antibodies. So they don't have a scale here, which is interesting. So I don't know if this is like nanograms per milliliter, micrograms per milliliter. Yeah, so if I was reviewing this, they would definitely need to put a scale here. Oh, it's a dilution. Okay, it's a dilution factor. Okay, so there's no scale because it's just a dilution. Okay, so you see that they have neutralizing antibodies that kind of decrease over time. Yeah, Yeah, so they said it's asymptomatic or mildly symptomatic. They seem to be the same. It's pretty, that's good. And yeah, this is where they talk about how it's better in children. Anyways, after kind of browsing this, it seems pretty clear that children mount a very strong response to even asymptomatic disease. So I think this is very reassuring. The children are going to mount a good response. They're likely to have immunity even with asymptomatic or mild disease. And this probably means that they will not easily transmit it to other people as well, because if they have neutralizing antibodies, they won't have a high enough viral titer to transmit it to other people after their first infection. I think I don't know of any papers that measured viral load during their initial asymptomatic infection. I suspect that they can transmit it at that point. So as long as the adults in the household are vaccinated, that shouldn't be an issue, or should be actually less of an issue. And the fact that, and they will probably transmit it to each other, because when they're going to school, kids are going to hug each other, and they're not going to, they're probably not washing their hands that well. And especially when children are playing sports together, they're playing basketball, they can do all these things of like testing people, or some people try to wear masks while they play basketball, which doesn't make any sense to me, because basically it's a contact sport. They are probably going to transmit it to each other, but they'll have mild or asymptomatic disease, and then after that, they probably are going to have significant immunity to any further infection. So I think this paper is very reassuring for people that are having kids go back to school and participate in activities. So thanks for watching. I'll link this paper in the description.